UTIs, urinary tract infections, is an infection of the urinary systems, which ranges all the way from the kidney to the ureters to the bladder and the urethra. The most common UTIs are lower UTIs, which involves the bladder and the urethra. UTIs amongst women is more common than it is amongst men. And today we are going to lean towards the UTI in women. So the reason as to why UTI is more common in women is because of two reasons. One is the anatomical disadvantage, and number two is the length of the urethra. Anatomical disadvantage to mean when we are looking at the female system down there, we have three openings. We have the vaginal opening, we have the anal opening, and you have the urethral opening. So what happens is that it becomes very easy for any form of organisms to come from either of the other systems into the urethral systems, bringing about occurrence of UTIs. Secondly, I did say that the urethras are really short in women, 3 to 4 centimeters. And that means when that organism comes towards the urethral opening, it is very easy for it to travel fast enough into the bladder where it's going to localize and multiply, and then you end up with a UTI. So what brings about UTIs? There are very many things. Say there are either things from outside in or things that are inside out. By outside in, number one, you can talk about hydration. If you're not hydrating enough, then that means you're leaving room for bacterial overgrowth in the urinary system, and as a result, we get a UTI. Secondly, it is sexual activity. Not to say that UTIs are sexually transmitted, but during the process, there is normally a lot of movement. And because of that movement, there is a possibility of transfer of organisms from one opening to the other. The other one is hygiene. How do we wipe? Do we wipe front to back or back to front? Ideally, you should be wiping from front to back. That way, we reduce the chances of any organisms from the anal opening coming to the urethral opening, and as a result, setting off a cascade in which the eventuality is a UTI. Secondly, in hygiene is douching. If there's one thing we should never do is douche, because around down there, we normally have normal bacteria that are set in certain numbers. So if those numbers are disrupted in any way, that means they are too high or too low, then it upsets the balance that's down there. And when that balance is upset, then that means organisms that shouldn't be there, or other organisms that wouldn't develop if the area were at optimum, will start developing, and therefore we start getting UTIs. On that note, people who are constantly taking antibiotics, remember, antibiotics are meant to clear bacteria. And not to say if you had a bug in your stomach, it will not clear a bacteria somewhere else. So when you're constantly taking antibiotics, then that means as much as you're flushing out the bad bacteria, we are also flushing out the good bacteria. And that as well upsets the environment down there, making it vulnerable to get UTIs. From the inside out, it is not advisable that you hold your pee for long periods of time. Reason being, pee is waste. And if that waste is held within a space for a prolonged period of time, then it gives the bacteria time to multiply and make more of themselves, and as a result, we end up getting a UTI. So it is important that once you are pressed, make sure that you go relieve yourself. Another issue that can contribute to UTI is medical conditions such as diabetes. People with diabetes, because sugar is excreted through the urine, the fact that there is a sugary environment down there, it makes it easy for bacterial overgrowth. Another condition in which you'll find a recurrent UTIs is in pregnancy. It's because of the changes that occur around pregnancy that make it possible for this UTI to occur more and more often. To keep ourselves safe, we can do the following. Of course, you ensure you hydrate as often as possible, and do not hold your pee. So when you feel the urge to pee, immediately go clear your bladder. Ensure to pee after coitus, very important. Avoid taking too many antibiotics. Avoid scented sprays and douches that are commonly sold in supermarkets out there. Also, it is important to wear undergarments that allow airing down there, and the most recommended one is cotton wear. In the event of a UTI, the following symptoms can be noticed. Commonly, it's a lower abdominal pain that goes all the way to the lower back. There's a burning sensation while peeing. The pee can be smelly and appear cloudy, and as well we can have an urge to urinate frequently. There are also cases whereby we have recurrent UTIs or a UTI that is not clearing. When you get to that point in time, it is very, very important that a culture is done. What a culture does is be able to identify the exact organism that is causing this UTI and the antibiotic that is sensitive to manage this UTI. And once that is done and you're given the right medication, then the UTI clears.